Hey guys, this is Krish V, your favorite PAC, coming at you today with another hot topic video. Today we're going to be going over some facts and some research I found from scientists, medical professionals on the CV-19 virus. First and foremost, let me just say that anything you hear on this channel is not medical advice. Please, go talk to your medical provider for any medical information or any recommendations. This is just for entertainment purposes. So I want to start the video with a quote from Dr. Alan Preston in regards to the current virus situation. He states, "The fatality rate is completely and absolutely overstated." Dr. Michael Levitt states that this whole entire situation was handled in a very anti-scientific way. But Krish, you're probably getting these facts from quack doctors. Why should we listen to you or listen to what these doctors who probably use turmeric and ashwagandha to treat patients with? Well, that's a great question. Dr. Alan Preston, he is a professor in epidemiology, and Dr. Michael Levitt, he is a Nobel Prize winner. Dr. Michael Levitt also stated in an interview that when he looked into the research, he could compare the death rate to the 2017-2018 flu season. I'm not sure if you guys know, but many doctors, many medical providers in the hospitals have been pretty vocal about how they are incentivized to list COVID as the death or COVID related cases. This is because the government regulations did not allow hospitals to do elective surgeries and certain procedures. This is how hospitals make a lot of their money. So many hospital systems in our country were bleeding money. They were severely lacking funds that they normally get, and now they were incentivized to list COVID as the cause of the death or treatment options, and they were incentivized because they were going to get more money for it. I want to read you guys a quote from Senator Scott Jensen, MD. He's a medical doctor. He said, "I was coached and massaged to utilize CV-19 as a factor in the causation of death, even if I hadn't checked a CV-19 test." Obviously, he didn't say CV-19, he said the virus name. He then discusses how there was a big part of time where they didn't even have to test for the virus. As long as they suspected the virus in any way, shape, or form, which is a multitude of ways if you guys have been keeping up with the signs and symptoms of this virus, as long as they suspected it, they could list it as the cause of death or reason for treatment or whatever it is. Senator Jensen also then goes on to discuss how they might try to use this virus to roll out involuntary contact tracing using our cell phones, and how a lot of these things that are maybe starting to emerge are really cutting into our civil liberties. Next, Dr. Michael Rosen, he's the Chief Wellness Officer at the Cleveland Clinic. His studies in the fatality rate shows that if you are 70 or older, then your chances of dying from this virus are greater than about 3%. And that's a pretty significant number. But it is individuals that are 70 and older. That isn't a huge portion of our population. He then goes on to say that if you are 60 years old and under, then the chances of you dying from this virus are closer to 0.002%. He then goes on to talk about how the aftermath of this virus is very concerning in comparisons to the virus itself. You have to remember, suicide rates, depression, drug overdoses, these are all things that have been growing like crazy in our country. So now a lot of people are questioning the length of the lockdown that we had and its economic impact. People are going to lose their jobs. I mean, tons, millions and millions of people have already lost their jobs, and a lot of people are not going to get their jobs back. Lots of people are going to lose their houses. People are going to be forced into poverty. It shows that the poverty rate has a correlation with death rates in America. So many of you know that the World Health Organization, the WHO, had a big role in how this virus was handled, how some of the research and data presented was given to our policymakers. And Bill Gates is one of the big players in the WHO. He has contributed over $3 billion to the organization. He funds about 10% of the organization, and he plays a big role in the policies that are coming out of that organization. Currently, America has stopped funding the WHO, and they're looking into the organization itself and questioning the research that was given. And I think it's important that we do question what happened. This whole situation has impacted many, many lives, and we need to know why were these recommended guidelines put out. Where was the data? Where are the facts showing that we needed a prolonged lockdown throughout our nation? I understand maybe certain areas like New York, but when you talk about the entire country and areas that are not heavily populated, it didn't make sense that we shut down the entire country for a virus that's not having a major impact on 97% of our population. I know during the whole crisis, everybody was looking towards Italy on what's going on, and I think the media really blasted Italy a lot, and for a good reason to some degree. But I feel like they didn't really educate the people on the Italian healthcare system. I'm making a video on that very soon, so stay tuned for that. It's going to actually go into why Italy had the reaction it did, more information on that Italian healthcare system. If you found any of this information useful, please like, subscribe, and share this video so more people have access to it. I really appreciate it. Let me know how you feel down in the comments. Guys, I hope you enjoyed the video. I got a lot of information from actually Tony Robbins. He did an interview with a lot of these doctors and collect a lot of research and data himself. So, go check out his videos. He puts out some good stuff. And I'll see you on the next one.